interviewing Dr. Eustace Semmes, affectionately known as Pappy, and my old chief, who is one of the founding members of the Cushing Society, now known as the Association of American Neurological Surgeons. Dr. Semmes, it's been 50 years since the first meeting of the Cushing Society, and we'd very much like to know about some of those preliminary discussions that you and Glenn Sperling and Van Wagenen and Temple Fay had, and how you went about forming the Cushing Society.
Well, Dr. Glenn Sperling and myself at a luncheon at a meeting in Memphis discussed the situation, and we both agreed that the Senior Neurosurgical Society had invited us to their meetings and were very hospitable, but they were not going to invite us to become members. We therefore decided we must have our own society. And we decided that it should be confined not entirely to neurosurgeons, but to neurologists and urorentgenologists and even psychiatrists, if one could be found with both feet on the ground. And we got in touch with practically all of the young neurosurgeons at that time, which were about 25.
Did you and Sperling meet here in Memphis, and then how did Van Wagenen and Temple Fay get into the act?
We called them, and they came in with us. Dr. Cushing's name was suggested as the name of the society, the new society, by Dr. Temple Fay.
The meeting in Memphis, it was just you and Sperling, though.
Yes.
And when was the next meeting of the four of you?
Just a short time, a few weeks.
Where did you meet then?
In Washington.
I see. And did you all plan the whole scientific meeting, or did you?
Well, we went through all those things to start with. We thought everybody would agree with us, and they did.
And then how did Dr. Cushing receive this?
Dr. Cushing was interested, and his attitude was paternal, and he gave us a surgical clinic.
Where was the first meeting held, in Boston or New Haven?
In Boston, at his invitation.
I see. What sort of case did he operate on for the surgical clinic?
As I recall, it was a brain tumor, and I think pituitary.
A pituitary tumor?
It seems to me like it was a patient brought over from England by a urologist in England.
Do you remember any of the other scientific parts of the program?
No, I can't say that I did, except we were not able to recognize anybody on the stand because they all had on masks and caps. The only people we knew who they were Dr. Cushing and Dr. Horrocks, his assistant.
What sort of a social affair did you have at the meeting? Was it a cocktail party and a banquet type thing? Or?
Well, I don't recall that we had anything like that, but I presume we did.
Were the ladies welcome to neurosurgical meetings in those days?
There was one, Dr. Cushing's neuropathologist from Yale.
I see.
She was a member of the society.
That was Louise Eisenhart?
Yes.
Was she as sweet a lady then as when I got to meet her a few years later?
Probably sweeter.
I see. Certainly better looking in those days, huh?
Yeah.
You've often said that neurosurgeons are the finest people you know and marry the best-looking ladies. Do you still feel that way?
Best looking and nicest.
Best looking and nicest. How long did the first meeting last?
As I remember, it was 3 days.
I see. Were people invited to present papers other than Dr. Cushing's surgical clinic?
I don't believe they were. I don't remember the program, so I don't imagine it mounted as much.
Other than Dr. Cushing, who do you remember the most as an outstanding member of that original meeting?
I'm just trying to think who they were. One of them from Yale, a professor from Yale, was a member of the Cushing's, of the Senior Society.
I see. You told me that back in your preliminary discussions about the Cushing Society that Dr. Sachs heard of this and gave you all a call. What did he have to say when he called?
Well, he called Dr. Sperling. Evidently he knew some way that we were in Washington and asked him not to form a society. He said, three of you, four are going to be, of your group now, are going to be elected this year.
To the Senior Society?
Yeah.
Did he tell you which one wasn't going to be elected?
No, it was self-evident. It was Temple Fay.
Was Temple Fay sort of a radical?
The rest of us were all trained under Dr. Cushing.
I see. So you all decided to stick with Fay rather than abandon him, huh?
Yes, that's because he was dynamic.
What was he like? You say dynamic. What do you mean?
Well, he got all sorts of fancy ideas, most of which were wrong. But he was...
Did he...
stimulating, at least.
I see. Now, he was from Philadelphia, was he?
Yes.
Yeah. Who did he train with?
He just trained in the Temple University.
I see. Wonder what the budget of the first meeting was in terms of dollars.
I have no idea.
Yeah. It certainly wasn't a very expensive meeting, I tell
No. And Boston had cheap hotels that were available.
Comparing the organization with the 1931 meeting and the American Association of Neurological Surgeons now, what do you think about the changes that have occurred?
Well, of course, the neurosurgery has advanced very rapidly, and I think pretty highly satisfactorily. We had a training schedule in which we had about 76 residents, and none of them have failed boards, so we feel sure that we must have a good training schedule.
Dr. Semmes, the Cushing Society has grown into a huge organization now with many neurosurgeons involved in many things, and it's an organization that's filled with committee activities and complicated organizational work. What do you think of a big organization like that representing neurosurgery?
Well, when we started, we intended to get together a group which would speak for neurosurgery in every situation.
You think this organization still does that?
I think so, yes.
What do you think about the numbers of neurosurgeons nowadays?
Well, I think there are plenty,
You think you're too many?
perhaps a little.
What did you used to feel were enough neurosurgeons?
We figured that 300,000 would support one.
I think nowadays they're talking about 1 per 100,000. Do you think that's too many neurosurgeons?
Probably not.
Probably not.
They're taking the extra things like the vessels, so forth.
Do you think the neurosurgeons of the Cushing Society or the American Association nowadays are technically as good as you old pros?
Well, I think probably, considering the fact that they had lots of things to help them out that we didn't have, like CAT scans and so forth.
Yeah, that's a fantastic machine.
I'm trying to get our men to write their diagnosis before they put them in the CAT scan to see how they come out. I think they're going to come out pretty well.
Do you
I think a good examination and a thorough history will enable you to diagnose early all neurosurgical conditions.
What about the impact of the Semmes Murphy Clinic on the American Association of Neurological Surgeons? Do you think it's had much of an impact, or is it enough impact to suit you?
I think that we have spent a good deal of time. All of us have been presidents of the Cushing Society, and half of us of the board, what is the other?
The Congress of Neurosurgery?
The Congress of Neurosurgery.
Was Dr. Cushing pleased over the establishment of your practice here in Memphis and the subsequent clinic?
Well, every time I went there, which was nearly every year, he was very courteous to me and always asked me to come down, stand behind him, while the doctors who sent the patient to him was up on the stand. And he took me to dinner at his home, which was in the summer, and there was nobody else there. And he had a rather scarce dinner. But at 9 o'clock, he would tell me I had to go home, that he had to do some work, paperwork.
You mean he'd have you for dinner and then stand up and tell you it was time to go home?
Yeah.
I'll say, what did Mrs. Cushing say about it?
She wasn't there.
I see.
No, his daughters. This was in the summertime.
What sort of conversationalist was he?
Well, he was very interested in what he talked about.
Did he let you talk some, or did he dominate?
Not much.
I see. He mostly was telling rather than listening. What do you see as the present strengths and weaknesses in modern-day neurosurgery? We've talked about numbers.
Well,
Are
I
there
think
any others?
in general, men are getting very good training in a good many places, so they ought to be able to do a first-class job.
Do you think there ought to be two classes of neurosurgeons? You know, there's been a lot of talk about the small number of tumors in proportion to the number of neurosurgeons. Do you think there ought to be two classes of surgeons, or just everybody be trained to do everything?
Well, I think that they ought to be specialized, like in our clinic. There's one man that does all the children, and one man that does all the needlework, and everybody does ticks and discs, of course.
So that you would favor a subspecialization?
Yes.
Do you think Dr. Cushing would have supported that?
I don't know. I think he wanted everything for himself. I mean, he thought he was able to do it, but he didn't do anything with the spinal cord.
That's always amazed me that he didn't do anything.
I remember at his birthday meeting, we were talking about ruptured discs. And at the supper that night, he said that instead of getting on brain tumors and things like that, we just doing hard work on ruptured discs.
Did you point out to him how grateful those people have been over the years?
Yes.
Do you think there's still giants in nursing? Excuse me.
I had been elected as president the year before, but we found out afterward that it was, what is the girl's name?
Louise Eisenhart?
Louise Eisenhart's birthday. And so I gave up the presidency that year and took it the next. And that was Dr. Cushing's 70th birthday, which turned out luckily for me.
Oh, you were president when he was on his 70th birthday?
Yes, and they had all people from all over the world there visiting. I was up at the head table because I was president.
I bet that was a fanfare.
It certainly was, yeah.
That kind of fulfills your adage, you'd rather be lucky than good any day. Do you think there are still giants in neurosurgery?
Well, I think that the average neurosurgeon is really a giant in some respects, a smaller giant than the old ones. But the first 12 men were really geniuses that went into neurosurgery.
I don't think there's any doubt about that.
They all became heads of departments.
You know, neurosurgeons are involved through their committee structures in many activities nowadays.
I know, yeah.
Such things as socio-economic committees that occupy a lot of time dealing with governmental influence in medicine. What do you think about that?
Well, I think somebody has to do it, and might as well be the neurosurgeons.
What impact did people like Dr. Penfield have on the history of the Cushing Society?
Well, of course, Dr. Penfield never did do anything but stimulate the brain and take out what seemed to be affected in fits. And his book, his last book, is well worth reading for anybody.
I haven't read it. I heard it was a good book.
He got down the way. He thought there must be a soul.
You think that's a revelation for him?
Yes.
Have you ever had any doubt about things like that?
Does he?
Oh, do you? Have
No.
you ever had a doubt that you had a soul?
No.
Tell us about Walter Dandy and Dr. Halstead and Dr. Cushing's relationships.
Well, Dr. Walter Dandy got along badly with Dr. Cushing. He wasn't among the first 10, so he didn't get to choose his place on the staff. But Dr. Cushing gave him an extra one.
You mean Dr.
I mean, Dr. Halstead.
Halstead. He was one of Halstead's favorites.
Yes.
I see.
I remember one time I was standing behind Dr. Dandy operating. They took out a lump of stuff and turned around and dropped it in my hand and asked me what I thought that was. I told him I thought it was an abscess because it flattened a little bit when he put it down. I came back there after going to East a few days later. They said, "You know what that was?" And I said, "No, what?" They said it was a tumor which had softened inside with the thrombosis of the vessels, and it was just a mixture of grumous material.
You know, you always seem to be able to be friends with most important people, like in spite of Dandy and Cushing's conflicts, you were friends with both of them. How did you manage to do that?
Well, Walter and I were classmates at the University of Missouri. We worked next door to each other during in the laboratory. And we all went out. Dr. George Lefevre, the professor of zoology at Missouri, persuaded us all to go out to Johns Hopkins together. And we took all of our senior class was covered with medical subjects. So when we went there, we were examined by the staff orally, and then they let us go into the second year. So we got through Hopkins in 3 years, which was bad because we could have learned more.
Did Dandy ever discuss his relationship between Cushing and himself with you?
Yes. I got him after him many times to keep him from being riled over the thing. I told him he just ought to forget it. Dr. Cushing was his teacher, and he ought to just put up with it.
Who do you think?
But he didn't want to do that. He said he wouldn't do it.
You mean he wouldn't apologize, or he kept on fanning the fire?
Well, keep on fanning the fire.
Would he speak
Dr.
openly
Cushing.
against Dr. Cushing?
Yeah. Mm-hmm.
You mean in a crowd of people he would say something?
I'll say not a crowd, just a few people.
Well, Walter Dandy and you apparently then went all the way through college and went to Hopkins together, and then did you take part of your training together?
Well, I used to go up and visit him every time I went east. I'd stop by a few days and see him. Never will forget, I went in there one day and he said, "Hi, Eustace." And his resident said, "Do you know what you said, Dr. Cushing, Dr. Dandy?" He said, "Sure, why not?"
You once told me about the shortest letter you'd ever received seemed to have to do something with a tick patient in Dr. Dandy, didn't it?
I wrote to Dr. Dandy and asked him if he thought tick was rare in blacks inside at Eustace. And he wrote me back and said, no, Dandy, Walter.
Tell us about how you learned ventriculography.
Well, I was up there in the operating room the day he did his first one, when he put the air in.
Where did he used to
And
make?
I came down here the same month and did one in Memphis. So we started together, although it was his idea.
Were there complications of ventriculography that gave it a bad name initially?
No, it was put down by Dr. Frazier in a loud voice. But the next year I saw him down at the meeting in New Orleans where he and Grant exhibited a body, made-up body, a false body, to show how you did it.
How you did a ventriculogram?
Yeah, and so he was all in favor of it then.
Yeah. To change the subject and talk a little bit about the Semmes Murphy Clinic, which I know is dear to your life, how did that outfit get started? Did you have an associate before Francis Murphy came down here?
No, I did for myself about 10 years. And Dr. Paul Busey was coming through here one time, stopped off to see me. And I told him I was desperate and in need of help. And so he picked up the phone and called a Chicago hospital and told him to put Dr. Murphy on the phone. And when he told him to get on the train and come down to Memphis. He said Dr. Murphy had always said he was going to practice in Memphis. So he thought that'd be a good idea for him to start. So he came on down and we arranged for him to come back as soon as he finished his internship. I had always wanted a man who had had no training because I wanted to train him myself. And he was just an ordinary intern there. So his first neurosurgery was with us.
Was he a good student or not?
You know, he was very, very set in his ways and ideas and beliefs, and nearly always right.
He got more set as the years went by, as far as I'm concerned.
No doubt, yeah.
Did you require him to keep a list of his cases in his early years?
No, they were all there in the office. He just acted as an assistant for a long time, all the 10 years, really, till we got some more.
When did you finally allow him to do big craniotomies? After 2 or 3 years, or did you make him wait longer?
Well, there were just the two of us in generals, so I would help him with the case.
So you all would operate together on
Yeah.
big cases, on every case?
Practically everything.
When did you get so interested in ruptured disc?
Well, I did the first disc. The man, I thought he had a tumor. And I looked in there, and there was a hole in the anterior, in the ligamentum. And sticking out of it was a chunk of cartilage. So then, I got a few more of them. And at first I thought they were just oddities. But in a short while I'd done 6 of them. I went up to Baltimore and I stopped to talk to Dandy about them. He said, well, he had found the same thing and it's already put on the literature, in the literature. But so I just went back and didn't put the literature, which was a mistake, of course.
When you first started doing the disc, how did you know where to go? I mean, did you know the neurological syndromes of the 5th root and the S1
Well, yes,
root?
of course,
we
could tell what the level was.
And then, of course, you did them all under local, so when you stimulated the root, you knew where you were.
Yeah.
Do you think it's a good idea for us to abandon local anesthesia?
I think it's foolish and wrong.
How can we change the present wave of anesthesiologists thinking that everybody has to be put to sleep?
I think you'll have to drown about 1,000 anesthesiologists.
You know, you changed the total laminectomy approach to a partial hemolaminectomy approach.
That's the paper I read at Dr. Cushing's
Birthday party?
birthday party, yeah.
How was it received, the paper?
Well, I just had said you could do it with a small approach and you could diagnose it without x-ray because of the neurological findings.
How did your colleagues receive that one?
Well, they were a little skeptical.
You know, here in Memphis, we've always felt that we didn't need a myelogram on a classical case.
That's right. Yeah. That's the signs and symptoms are more reliable than anything else. So if it doesn't show in the x-ray, we go ahead and take it out.
Recently, I was at a meeting and I said I would do a cervical disc if it were a classic C5 or C6 disc, and everything fitted, and they asked for a show of hand. I'd do one without a myelogram. And they asked for a show of hands, and only 1% of the people in the big audience agreed with me. Do you still feel that you can do it without a myelogram?
Well, I think for the records show that it's done that way.
What about the instruments that, such as the Kerrison punches and things like that? When you first started doing a partial hemolaminectomy, what sort of instrument did you have to take off the lamina?
Well, it wasn't very good, and I got the instrument people in Chicago to make one which was perfect, except that they had the horn that stuck out was in the wrong place. It should have been underneath.
Whatever happened to that instrument?
It's still making it just that way. It's on the wrong side.
What's it called? I've never seen one.
It's up there. They had got a dozen of them up in the operating room.
You mean it's a back-biting instrument?
Yeah.
It doesn't bite forward?
Yeah, no, it bites forward. But you just push it up under and bite.
But, you know, for years you had that little black dissector that looked like a modified Penfield 4 that you used to hold the root with. Is that one a dissector of your design?
Yes, it was broken off.
And why did you always, you never did like shiny instruments. You always liked either varnished instruments or...
I think it's mainly they got old.
I see. The other thing I wanted to ask you is, what about your relationship with the Baptist Hospital? Why did you come here, for example?
Well, I was born here over on Union Avenue.
But I mean, was there no other hospital in town except the Baptist?
Yes, there were others, but I did all my work here.
Yeah.
I was discharged from 2 hospitals.
Why?
The John Gaston and the Rooster Brinkley, because I insisted on having the first-class technique.
And you literally were discharged?
Yeah, the lady, the president, called me up. No, I called her up and told her I wanted to resign. And she said, "You're too late, we've already fired you."
What'd you say to that?
I said, "Thank you." And then I got fired from the John Gaston because I said that to a newspaper reporter that the people who were running it didn't know what an operating room should be, or how it should be run, and they were too stupid to learn. So they invited me out.
Now, when you went to the Baptist Hospital, it was just this old P&S building, is that right? Or was the hospital wasn't very large?
Just one building.
Yeah. And being a practicing Catholic all your life, was St. Joseph not in existence then?
Well, the bishops Baptist bishops in Mississippi came up to inspect the hospital. They went back and told them it was being run for 2 Catholics, a Jew and an infidel. John Shea and I were the Catholics. Henry Rudner was the Jew, and Smythe was the infidel.
So they were happy over that or unhappy?
Unhappy.
Do you remember when you took your first assistant other than Murphy?
I just used the surgical residence.
What'd you do during the war?
I went to France.
Yeah.
And I was within the hearing of the guns all the time I was over there.
Did you do any surgery, or
I didn't do too much surgery because although it was a 1,000-bed hospital, we had to ship them so fast that we didn't get to do much except emergencies. We shipped them all back to the Hopkins unit.
So it was after the war that you went back and took your neurosurgical training?
No, I'd had it before that. When I first came down here, I was put in charge of neurosurgery. And when I went to the war, I was a neurosurgeon to a 1,000-bed hospital.
I can see now why you used to be so careful about controlling bleeding and meticulous technique to avoid infection. You must have seen a lot of infection during the war.
I've been meaning to stop at one of these places where they're howling for loss of blood, tell them to put some committees in and see where they're losing it. If it'd keep it in the body, they wouldn't be short of blood.
The technique that you used from learned from Dr. Halstead, in the years that I got to operate with you, I certainly admired every bit of it. And although your memory is more convenient than mine, I really don't remember any wound infections of yours.
I had one wound infection in the head and one in the back.
Where did you get that adage about keep your hands off the skin?
I don't know.
Seems like a good one. I know you used to, I don't think Dr. Murphy ever learned that. You used to constantly tell him to keep his hands off the skin. Do you remember that?
No, I made them keep the blood off their gowns. When I got through operating, I was disgraced if there was a spot of blood on me anywhere. Because we didn't let them bleed. We controlled it before it bled.
Getting back to the Baptist Hospital, one of the things that always amazed me is how you and Dr. Murphy and Dr. Frank Groner were such great friends. How did that come about? He came up here from New Orleans. You didn't know him before he came,
No.
did you?
Well, we had most of the patients in the hospital, but it had something to do with it. We frequented around about 300.
Yeah. But nevertheless, he seemed to treasure your counsel, and you all always had a great respect for him.
Well, he had a ruptured disc that I gave him some advice about.
I think that's what did it.
Lumbar disc. No, I don't think so. I think it's just because he wanted to keep the hospital full.
What do you think about the nursing care that you see in walking around seeing patients now compared to 20 years ago?
Well, you don't see any as we go around now. You don't see anybody getting nursed.
Does it bother does it bother you that you walk into a nursing station and all the nurses are sitting and they just keep on sitting?
No, I'm used to it.
They didn't do that in your day.
No, the nurse came out with your charts in her hand, walked down the hall with you. The head nurse went in to see the patients, took all the notes that necessary.
Well, do you think that they would call you when the patient deteriorated any better than they do now?
I believe so, yes.
Well, you know, I agree with you. I just wondered what you thought. What do you think the modern-day patient in the hospital lacks the most in his care?
Well, I think probably nursing.
And I never will forget that article, article that you wrote on In Favor of Simplicity. You remember that at the time you read that paper, somebody had made a country music record called Transfusion?
Yes, and it was from the East Coast.
Yeah. And
I think from the University of North Carolina.
as I recall, the poor fellow had been admitted to the hospital, and they had taken so much blood out of him to do tests that he was claiming he needed a transfusion. Do you think we do too many tests nowadays?
Probably, a few.
In our residency training program here in Memphis, what do you think are our strengths and weaknesses?
Well, we have plenty of material, is one thing.
That's certainly a
And
strength.
we have plenty of help. And we have a CAT scan to check us. So I think that in general, the thing is going along very satisfactorily.
Except you'd still like to see more local anesthesia.
Yes. I don't think I've done all I could do. I've read a lot of papers on the subject. I remember I was invited to give the Elsberg lecture in New York, and they asked me to talk about local anesthesia and neurosurgery.
I remember when you did that. What did you know Elsberg?
Yeah.
What sort of fellow was he?
During the First World War, I spent 6 weeks in New York taking a neurological crash course. We worked on it all day and half the night. I learned a lot of neurology from Dr. I've forgotten which one.
You mean, was that at the New York Neurologic Institute?
Yeah.
But Elsberg, was he a pretty good neurologist, or?
Yeah, pretty good neurosurgeon, yeah.
Yeah. It's interesting that he apparently spent most of his professional life on spinal problems.
Yeah, and local anesthesia was one of the principal ones.
Oh, he used local anesthesia
Yeah,
too?
he said he'd done 6,000 laminectomies under local anesthesia.
I remember you used to talk about D. Martel and local anesthesia.
Well, of course, he was famous for a lot of different things besides local.
And at one time, did you have correspondence with the Rutanov about the Russian neurosurgeon?
Yes,
about
he
local?
offered to come here and do some splitting down the middle of the cord.
Myelotomies?
Yeah, to catch the centrous fibers where they went across the cord.
But did he use local anesthesia too?
Well, the Russians give me credit for getting them into local anesthesia.
I'll say, I thought you'd had some correspondence with him.
Yeah.
Back to the Semmes Murphy Clinic, after you and Murphy had been together all these years, the next one who came along was Dutch Schultz, is that right?
Mm-hmm. He was a very good man.
Oh, excellent man.
He'd been trained in Detroit.
How did you and Gail Crutchfield get to be friends?
Well, just going to the meetings, I think. And his wife was a friend of mine, too.
Because you ended up not only Dutch coming down here, but Dick DeSaussure followed.
Oh, he came from University of Virginia.
Well, Crutchfield trained him.
Yeah.
Yeah. I thought Schultz had spent some time with Crutchfield.
I believe he did, yeah.
Yeah. And then for a long time, you didn't have any other associates, did you?
That's right. Then we got DeSaussure. I don't know when I've been asked how long the clinic had been in existence, but I don't know when you'd begin to call it a clinic. Perhaps we get 4 men.
Well, I'm not sure. It's still known, you know, as Semmes and Murphy. Most people leave the clinic off. I can remember those old days over in the old building when you all had that great camaraderie between J.D. Evans and Ed Koch, and that little, seemed like your best friends were right there across the hall from you. Here in Memphis at the Baptist, who do you think you would name as #1 as the best general surgeon that you've worked with over the years?
I think Dr. Patterson.
What about the internist?
Well, there are too many of them, I can't tell. My own doctor is Dr. Upshaw.
Yeah, but I think that's
He's
because he
also
went to Hopkins, yeah.
Very likely, yeah.
Yeah, that's right. As a young neurosurgeon going into practice here in Memphis, what advice would you give to a man? If, you know, if a young man asks you, how can I be a success here in Memphis?
Well, I'd try to get the associations that would lead me to it.
So you wouldn't go in practice by yourself?
No, that's too hard. You got somebody to talk to, look at your stuff with you.
Get you out of trouble when you get in trouble.
And uphold you at night.
One other thing that always tickled me was how you didn't like to operate before 10 o'clock in the morning, and yet you'd stay up all night seeing patients if necessary.
Well, I never was an early bird.
So this wasn't...
I was a night worker.
This was just your own particular time you liked to operate.
And the head nurse always kept the thing open, the 10 o'clock's open, till I hauled it off. So I didn't have to operate in the afternoons.
Do you, the other thing that I remember about you, you'd usually do 2, maybe 3 cases, but you didn't do a great string of cases.
No. The only way I'd do too many was when an emergency would come in at the end of the day. But ordinarily I wouldn't do over 3. Of course, it depends on what they were. A disc you could do a handful of.
How did you learn how to do the tick operation?
From Dr. Cushing.
I see. Did you ever see Max Pete do one of them?
Yeah.
He's supposed to have been real fast.
Well, he is fast, but he didn't do some of the things. He had a nurse that did a lot of it.
Oh, really? Did he didn't make the exposure, you mean?
Well, he made it, but he just sticks some Novocaine in there and boots it up and down and go ahead with it.
The other thing...
Another thing, he had a very good man, that Edgar Kahn, to help him.
He's a fine fellow. Kahn was down here during the Second World War, wasn't he?
Yes.
Is that when you all got to be pretty good buddies? Or?
Yes, I used to go out and do tumors for him. He said he hadn't done any tumors for 4 or 5 years, didn't think he could do them. I knew he was mistaken, but I went out there and helped him anyway.
He was always a sort of a shy fellow, apparently, when he was coming along in his training.
Yeah.
And yet he was a master technician.
Yeah. I told him if I had to have an operation on my spine, I'd call for him. I did have a doctor here who needed a spinal exploration, and I called him and asked him if I could send him up to him. This was a doctor who had an injury to his spine. And he said, no, I'll come down there and help you. So he did. And we didn't do him any good, but we thought we had to operate on it to be sure.
Let me change the subject, but I've wanted to have this discussed. You know, people around the country just marvel over the fact that the disc work is done by neurosurgeons in our community.
Half of it done by orthopedic people elsewhere.
That's right. Now, how did you arrange for the neurosurgeons to get the disc here in Memphis?
Through Dr. Speed. I told him I wasn't going to let any of my men do a fusion, because that was orthopedic. And he wasn't going to let anybody do a disc in his clinic.
Well, you know, I thought that Willis Campbell ran that Campbell clinic, but it was really Speed, the surgeon. Huh?
Yeah. Dr. Campbell was a very fine guy, but he was a poor surgeon.
How long did he work down here before he got Speed?
I got Dr. Speed down there for him.
Oh, from Hopkins?
Yeah, he was a class after me, and I called him, got him to come down here.
Well, what did Speed say when you made the deal about we wouldn't do fusions if they wouldn't do disc?
Well, he's the one that said it.
Oh, he's the one that said it? And you agreed with him?
Yeah.
And both of you have...
stuck to it.
Stuck to it. Do you think that'll continue here in Memphis?
I hope so, but I'm afraid not.
You know,
Of
there's
course, the Campbell Clinic sort of runs things just like we do.
so as long as that goes on, you
Yeah.
think we can hang on to it?
Yeah.
You know, there hadn't been any real advances other than maybe the addition of the microscope in disc surgery itself. The injection with the chemopapine kind of came, and I don't know if it's gone or not, but
Yes, I think it has.
what do you think we might do to handle some of these difficult back problems that we haven't done in the past?
Which ones do you
You know,
mean?
like the failed back, the patient who seemed to have a fairly decent disc, and yet you operate on him and he's never any good anymore.
There were very few.
Well, there are enough of them. It seems like maybe their presence seems to create great numbers. I don't know, but everybody seems to have a few of those people. What did you do with them over the years?
I was trying to think. The first thing we published was 6,000, wasn't it?
Something like some incredible number.
And as I remember, they were mostly psychological difficulties they had.
In other words, it was the makeup of the person.
Yeah.
Okay? Oh, I see. Well, I've enjoyed this interview with you very much.
So have I.
Is there anything that you'd like to discuss that we haven't discussed, like your early days with Dr.
Just going to
Lefevre?
say I've always felt that if I had to be operated on, I'd get you.
Well, that's a great compliment, Dr. Semmes. I think
The
that
cases I've done with you, those necks and things, impressed me with your skill.
well, I hope it's as good as yours. I certainly have enjoyed working with you. And even to this day, you know, I just cannot touch the skin, so you cram that down my throat.
You know,
The other thing it
you
used
keep
to...
the blood in the body, too, don't
Yeah,
you?
keep the blood. The other thing it used to tickle the hell out of me is we'd be operating, and if the assistant or the nurse or anybody else would get their head in the light, you would say, "Light does not bend." You have to move your head. Light does not bend. And the funniest thing was that if it got just a little hot or a little cold in the operating room, you used to tell Miss Turner to call the building engineer. And he never came, but you insisted they call him. One other thing I want to ask you is, you know, when you were 84, we all insisted you quit operating. And yet you, maybe to this day, still shave with a straight razor. How did you feel about stopping operating?
Well, it wasn't bad,
Well, did it make you mad?
no. I felt like that, too. The real reason, of course, was the lawyers. They thought if anything happened to a patient that I'd operate on, they'd say they were too damn old to be operating.
But other than that, did you feel comfortable operating?
Yes. My hands are still steady.
They're steady as a rock. Mine are not near that steady. What, in today's world, when would you advise a surgeon to quit doing big cases, like the big head cases that last several
I
hours?
think that depends on his physiological age.
Not his chronological age.
No.
So you don't adhere to the fact that if you're 65, you have to quit doing this or
No.
that?
I did them until I was 85, didn't I?
Yeah. I remember I was on your service when you were 70, and you had a hell of a lot of people in the hospital, and we liked to work me to death. So that clearly that wasn't retirement age for you.
I think the reason we get so many discs now is because there's so many pleased customers that are giving us recommendations.
Yeah, you must have seen great-great-grandchildren with people who have disc.
Yeah.
Because it's not uncommon that I see somebody that you operate on their mother or their grandpa or something.
30 or 40 or 50 years ago.
Well, thank you very much. I hope they enjoy this as much as I have.
Who's they?
The Cushing Society.
Okay.